We are going to start by talking about stages of labor. So there's 4 stages. So first stage, second stage, third stage, and fourth stage. So in the first stage, there are two sub-stages. So we have the latent phase and then the active phase. On the latent phase first, dilation is 0 to 5 centimeters. Onset of labor, contractions irregular, mild to moderate, and the frequency of contractions would be 5 to 30 5 to 30 minutes, and duration of the contraction is around 30 to 45 seconds. On the active phase of the first stage of labor, it's going to be 6 to 10 centimeters dilation. The contractions are going to be more regular, moderate to strong. The frequency is going to be more frequent, 3 to 5 minutes, and then the duration will be longer, around 40 to 90 seconds. The second stage of labor would be the full dilation and the pushing of the fetal descent. So this one is actually giving birth to the newborn. Third stage would be the delivery of placenta. So the thing that we have to remember is like the clamping of the umbilical cord, so that it needs to be done within 30 minutes. Because again, like the clamping signals that the placenta needs to detach from the uterus of the mother. And lastly, the fourth stage, which is considered the forgotten stage. This refers to the going back of the mother to her pre-pregnancy state, or the maternal stabilization of vital signs. Fetal station is the thing that how far is the presenting part from in relation to the axial spine. Axial spine is considered 0. So when the baby hits this one, the presenting part hits this one, it means that it's engaged. And anything above that one, it means like upper on the uterus, it's gonna be a negative number. So from 0, it's going to like -1, -2, -3, -4. And then the more the baby is coming out of the cervix and then vagina, it's gonna be a positive number. So +1, 2, 3, 4. When it comes to labor and birth process, there are 5 P's. So we have the passenger, passageway, powers, position, and psychological response. When it comes to passenger, the presentation of the baby could be either occiput, or the back of the head, chin, which is mentum, shoulder, which is scapula, or breech, or it called sacrum or feet. Then the fetal lie, it means that it's the relationship of the baby with the maternal longitudinal axis or spine of the mother. It can be either transverse, parallel, or longitudinal. The next one is going to be the fetal attitude. This one is easy to remember because either it's fetal flexion, which is chin flex to chest of the fetus, and the fetal extension, which means that the chin is extended away from the chest. The fetal pelvic or fetal position is the relationship of the presenting part of the fetus in reference to the directional position as it relates to the one of the 4 maternal pelvic quadrants. Here is the picture I found with different fetal positions, right? Again, the first letter is either right or left based on the back of the fetus. Then it's going to be whatever presenting part is coming out of the pelvic, which can be the occiput, the mentum, the scapula, or the breech. The third letter is going to be reference to the head. So either the head is the back of the head. The back of the head is in front, or the mother. It's going to be anterior. The posterior would be the back of the head is towards the back of the mother. And then transverse would be side view. All right, lastly, the biophysical profile. So this is like a gauge for us if the baby is doing okay, if they are non-reactive to the anesthetic test, non-stress test. So this one, the variables that are being tested on the biophysical profile, or BPP, would be the breathing movements, the gross body movements, the fetal tone, reactive fetal heart rate, and the quantity, the volume of the amniotic fluid. So either they're given a 0 or a 2. There's no one score. And again, if the overall score is around 8, it's still good. Below 8 would be problematic. So example, the breathing movements over here, a score of 2 is a greater of 1 episode of breathing movements in 30 minutes lasting above 30 seconds. The gross body movements, either the fetus has like 3 or more discrete body or limb movements within 30 minutes, and then fetal tone, greater than 1 or equal to greater or equal to 1 episode of active extension with return to flexion movement. And then heart rate, either greater than 2 episodes of accelerations in 20 minutes. Again, each acceleration is greater than or equal to 15 seconds and associated fetal movement. And the last one, it's either the baby has to have at least like one pocket of fluid that is around like 2 centimeters in 2 perpendicular planes. And then 0 would be absent of a pocket that meets the criteria.